Hello everyone, and welcome back. Today we are going to talk about a medication that nursing students will see everywhere, acetaminophen, also known by the brand name Tylenol. This medication may seem simple because it is available over the counter, but do not let that fool you. Acetaminophen is one of those medications that is very common, very useful, and very important to give safely. As a nurse, you will see acetaminophen ordered for headaches, fever, muscle aches, post-op pain, cold symptoms, and sometimes as part of combination pain medications. You may give it in the hospital, teach patients about it at discharge, or see it listed in a patient's home medication list. By the end of this video, you should understand what acetaminophen is used for, how it works, what makes it different from NSAIDs and opioids, what side effects to watch for, what labs matter, what patient teaching is most important, and what findings should be reported to the provider. And throughout the video, I will add pop test questions to help you think like a nurse. Let's start with the basics. Acetaminophen is classified as an analgesic and antipyretic. Analgesic means it helps relieve pain. Antipyretic means it helps reduce fever. So the two big uses are pain and fever. A simple memory tip is A for acetaminophen, A for aches, and A for antipyretic. Acetaminophen is usually used for mild to moderate pain. For example, a patient with a headache, toothache, sore throat, muscle ache, menstrual cramps, or mild post-operative discomfort may receive acetaminophen. It is also commonly used to reduce fever. For example, a patient admitted with pneumonia and a temperature of 101.8 degrees Fahrenheit may have acetaminophen ordered as needed for fever. Now, this is very important. Acetaminophen is not an anti-inflammatory medication. That means it does not work the same way as ibuprofen, naproxen, or ketorolac. NSAIDs reduce pain, fever, and inflammation. Acetaminophen reduces pain and fever, but it does not really reduce inflammation. So if a patient has swelling from an injury, like a sprained ankle, acetaminophen may help with pain, but it will not treat inflammation the way an NSAID might. Pop question. A patient asks, is Tylenol the same thing as ibuprofen? What is the best nursing response? A. Yes, they are the same drug class. B. No, Tylenol helps with pain and fever, but it is not considered an anti-inflammatory medication. C. Yes, but Tylenol is stronger. D. No, Tylenol is an opioid. The correct answer is B. Tylenol, or acetaminophen, helps with pain and fever, but it is not an NSAID and it is not an opioid. Now let's talk about how acetaminophen works. Acetaminophen's exact mechanism is not completely understood, but for nursing school, you can think of it as working mainly in the central nervous system. That means it acts more in the brain and spinal cord than out in the tissues. It helps reduce pain perception, meaning the brain does not sense pain as strongly. It also works on the hypothalamus, which is the temperature control center of the brain. Think of the hypothalamus like the body's thermostat. When someone has a fever, the thermostat is set too high. Acetaminophen helps bring that thermostat back down, allowing the body temperature to decrease. That is why acetaminophen is so commonly used when a patient has a fever. Here is a simple memory tip. Tylenol turns down the temperature. Tylenol turns down the body's thermostat. Now compare this to NSAIDs. NSAIDs block cyclooxygenase enzymes, also called COX enzymes, which decreases prostaglandins. That is why NSAIDs help with inflammation. Acetaminophen is different. It has very weak anti-inflammatory effects, so we do not use it when the main goal is to decrease swelling or inflammation. This difference matters because acetaminophen is often preferred for patients who cannot take NSAIDs. For example, some patients with gastric ulcers, bleeding risk, kidney disease, or patients taking blood thinners may be told to avoid NSAIDs. In some of those cases, acetaminophen may be the safer pain reliever, depending on the patient's liver function and provider orders. Pop question. Which organ system is most important to consider when giving acetaminophen? A. Liver. B. Lungs. C. Pancreas. D. Spleen. The correct answer is A. The liver. Acetaminophen is mainly metabolized by the liver, and the biggest safety concern is liver toxicity. Now let's talk about routes and forms. Acetaminophen can come in several forms. You may see oral tablets, capsules, liquid suspension, chewable tablets, rectal suppositories, and IV acetaminophen. Most commonly, nursing students will see oral acetaminophen. In the hospital, you may see orders like acetaminophen 650 milligrams by mouth every 6 hours as needed for mild pain or fever. You may also see acetaminophen 1000 milligrams by mouth every 8 hours scheduled. Sometimes acetaminophen is scheduled around the clock to help manage pain while reducing the need for opioids. For example, after surgery, a provider may order scheduled acetaminophen along with a PRN opioid for breakthrough pain. This is called multimodal pain management. Multimodal means we use more than one type of pain control strategy. The goal is to control pain while avoiding too much opioid use. Now this is where nursing judgment matters. Just because acetaminophen is ordered does not mean we give it without thinking. Before giving it, we assess the patient, review allergies, check the dose, check the time of the last dose, check the patient's liver history, and look for other medications that may also contain acetaminophen. Combination medications are a huge safety concern. Acetaminophen may be hidden inside many products. For example, it may be in cold and flu medications. It may also be combined with opioids, such as hydrocodone acetaminophen or oxycodone acetaminophen. Some labels may use the abbreviation APAP, which means acetaminophen. So if you see APAP, think Tylenol. Memory tip: APAP appears in pain pills. That can help you remember that combination pain medications may contain acetaminophen. Pop question. A patient has an order for acetaminophen 650 milligrams for fever. The medication list also shows hydrocodone acetaminophen for pain. What should the nurse do before giving acetaminophen? A. Give it quickly because it is over the counter. B. Check the total amount of acetaminophen the patient has received in the last 24 hours. C. Hold all pain medication forever. D. Give ibuprofen instead without an order. The correct answer is B. You must check the total daily acetaminophen dose from all sources. Now let's talk about dosing safety. For adults, acetaminophen has a maximum daily dose. Many sources and clinical settings use 3,000 to 4,000 milligrams per day as the upper daily limit for adults, depending on the product, facility policy, and provider instructions. However, many providers recommend a lower limit for certain patients, especially older adults, patients with liver disease, patients who drink alcohol regularly, or patients who are taking other medications that affect the liver. As a nursing student, the safest mindset is this: do not memorize only one number and ignore the patient. Always check the medication order, facility policy, the patient's age, weight, liver function, alcohol use, and other medications. In pediatrics, acetaminophen dosing is weight-based. That means you do not just give a child an adult dose. You calculate based on weight, usually in kilograms. For nursing students, this is a big test point. Pediatric doses are often based on milligrams per kilogram. Also, liquid acetaminophen needs careful measurement. Parents should not use a kitchen spoon. They should use an oral syringe, dosing cup, or measuring device that comes with the medication. Here is a clinical example. A parent says, "I gave my child some Tylenol, then I also gave a cold medicine because the fever came back." As the nurse, your next thought should be, does the cold medicine also contain acetaminophen? Because if it does, the child may receive too much. Pop question. Why is it risky for a patient to take Tylenol plus a cold and flu medication without reading the label? A. Cold medicines always cancel out Tylenol. B. Many cold and flu products may also contain acetaminophen. C. Tylenol becomes an opioid when mixed with cold medicine. D. Tylenol causes kidney failure in every patient. The correct answer is B. Many over-the-counter products contain acetaminophen, so patients can accidentally double dose. Now let's talk about side effects. When taken correctly, acetaminophen is usually well tolerated. It does not usually cause stomach bleeding like NSAIDs can. It does not usually cause respiratory depression like opioids can. It does not have strong antiplatelet effects like aspirin. That is why many patients see it as gentle. But again, gentle does not mean risk-free. The most serious side effect is liver toxicity, also called hepatotoxicity. Hepatotoxicity means damage to the liver. This can happen when someone takes too much acetaminophen at one time, takes more than the recommended daily amount, takes multiple acetaminophen-containing medications, or combines acetaminophen with heavy alcohol use. At first, acetaminophen toxicity may look mild. Early symptoms can include nausea, vomiting, sweating, loss of appetite, fatigue, or abdominal discomfort. Later, as liver injury develops, the patient may develop right upper quadrant abdominal pain, jaundice, dark urine, confusion, bleeding, or signs of liver failure. Jaundice means yellowing of the skin or eyes. Right upper quadrant pain matters because the liver is located in the right upper part of the abdomen. Memory tip: too much Tylenol troubles the liver. Another serious but rare reaction is a severe skin reaction. Patients should report rash, blistering, peeling skin, or sores in the mouth. Also, although allergic reactions are uncommon, nurses should watch for swelling of the face or throat, trouble breathing, hives, or severe itching. Those findings may indicate a serious allergic reaction and require immediate action. Pop question. A patient taking acetaminophen reports yellowing of the eyes and dark urine. What should the nurse do? A. Document it as expected. B. Tell the patient to drink more water only. C. Report it to the provider. D. Give another dose of acetaminophen. The correct answer is C. Yellowing of the eyes and dark urine may be signs of liver injury and should be reported. Now let's discuss black box warnings and major warnings. This part can be confusing because acetaminophen is available over the counter, but it still has very serious warnings. For single-ingredient over-the-counter acetaminophen, the key warning is severe liver damage if too much is taken, if it is taken with other acetaminophen-containing products, or if it is combined with significant alcohol use. Prescription combination products that contain acetaminophen have carried strong warnings related to severe liver injury. The main nursing takeaway is this: acetaminophen can cause severe liver damage, liver failure, need for liver transplant, or death when taken in excessive amounts. That is not meant to scare you. It is meant to remind you that common medications still require careful nursing practice. Here is a real-world example. A patient is admitted with back pain. At home, they were taking extra-strength Tylenol every few hours. They were also taking a prescription pain pill from an old surgery bottle that contained acetaminophen. Then they took a nighttime cold medicine that also had acetaminophen. They may not have intended to overdose. They may have simply not realized that all three products contained the same active ingredient. This is why patient teaching is one of the nurse's most important jobs. Pop question. What does APAP mean on a medication label? A. Aspirin. B. Acetaminophen. C. Ibuprofen. D. Prednisone. The correct answer is B. APAP means acetaminophen. Now let's talk about contraindications and precautions. A contraindication means the medication should not be used or should be avoided because the risk may be too high. Acetaminophen should be avoided in patients with a known allergy to acetaminophen. It should be used very cautiously in patients with severe liver disease or active liver injury. Patients who drink alcohol heavily are also at higher risk for liver toxicity. Alcohol and acetaminophen are both processed by the liver, and that combination can increase the risk of liver damage. Patients with malnutrition may also be at increased risk because the body may have lower stores of glutathione, which helps detoxify harmful metabolites. Let's make that simple. When acetaminophen is broken down, most of it is processed safely. A small amount becomes a toxic substance called NaPQI. Normally, the body uses glutathione to neutralize NaPQI. But if a person takes too much acetaminophen, the liver makes more NaPQI than the body can handle. Then liver cells can be damaged. You do not need to explain all of that to every patient, but it helps you understand why overdose is dangerous. Memory tip. NaPQI is nasty. Too much acetaminophen creates too much NaPQI and that can injure the liver. Pop question. The nurse should be most cautious giving acetaminophen to which patient? A. A patient with seasonal allergies. B. A patient with severe liver disease. C. A patient with a sprained wrist and no medical history. D. A patient with dry skin. The correct answer is B. Severe liver disease increases the risk of acetaminophen-related harm. Now let's talk about nursing responsibilities before giving acetaminophen. First, assess the reason for giving it. Is it for pain? Is it for fever? If it is for pain, assess the pain level using the appropriate pain scale. Ask the location, quality, severity, duration, and what makes it better or worse. For example, on a scale of 0 to 10, how would you rate your pain? Also ask what type of pain it is. Is it a headache, incisional pain, muscle ache, abdominal pain? This matters because acetaminophen may not be enough for severe pain or certain types of pain. If it is for fever, assess the temperature and look at the whole patient. A fever is not just a number. Ask, is the patient also hypotensive, tachycardic, confused, chilling, short of breath? Does the patient have signs of infection? Next, check allergies. Ask about allergies to acetaminophen or previous reactions. Next, check the medication administration record. When was the last dose? How much was given? Was there another medication containing acetaminophen? Next, check the total daily dose. This is very important. You are not just checking the one dose in your hand. You are checking the total amount over 24 hours. Next, review the patient's liver history. Does the patient have hepatitis, cirrhosis, liver failure, heavy alcohol use, or elevated liver enzymes? Next, review labs when available. Important labs include AST, ALT, bilirubin, and sometimes INR if liver function is a concern. AST and ALT are liver enzymes. If they are elevated, it may mean liver irritation or injury. Bilirubin can rise when the liver is not processing properly. INR can increase when the liver is not making clotting factors well. In an overdose situation, an acetaminophen level is important. Providers may order a serum acetaminophen concentration to guide treatment. Pop question. Before giving acetaminophen, which nursing action is most important? A. Check the patient's potassium only. B. Check for other medications that contain acetaminophen. C. Give it with grapefruit juice. D. Hold it for every patient with pain. The correct answer is B. The nurse should check for duplicate acetaminophen sources to prevent accidental overdose. Now let's talk about lab monitoring in more detail. For a healthy patient taking occasional acetaminophen as directed, routine lab monitoring may not always be required. But in the hospital, especially if the patient is receiving scheduled doses, has liver disease, has a history of alcohol use, or is receiving multiple medications, nurses should pay close attention to liver-related labs. AST and ALT are the big ones you will hear about often. These are enzymes found in liver cells. When liver cells are irritated or injured, AST and ALT can rise. Bilirubin is another important lab. High bilirubin can be associated with jaundice. INR may be monitored because the liver makes clotting factors. If the liver is not functioning well, the INR may rise, meaning the patient has an increased bleeding risk. If overdose is suspected, the provider may order a serum acetaminophen level. Timing matters. In many overdose cases, the level is interpreted based on how long it has been since ingestion. N-acetylcysteine, also called NAC, is the antidote for acetaminophen toxicity. NAC helps restore glutathione and reduces the risk of severe liver injury when given in time. As a nurse, you may not decide independently to start NAC, but you should recognize possible toxicity quickly, notify the provider, and follow orders. In an emergency situation, poison control may also be contacted. Pop question. What is the antidote for acetaminophen toxicity? A. Naloxone. B. Vitamin K. C. N-acetylcysteine. D. Protamine sulfate. The correct answer is C. N-acetylcysteine, or NAC, is the antidote for acetaminophen toxicity. Now let's talk about nursing interventions after giving acetaminophen. If you gave it for pain, reassess the pain level. Many facilities require pain reassessment within a certain time frame, depending on the route. For an oral medication, reassessment is often done about 30 to 60 minutes after administration, depending on facility policy. Ask, did the pain improve? Did the patient's function improve? Can they cough, deep breathe, ambulate, or rest more comfortably? Pain management is not just about making the number lower. It is about improving comfort and function. If you gave acetaminophen for fever, reassess the temperature. Also reassess the patient's overall condition. Did the fever decrease? Is the heart rate improving? Is the patient less uncomfortable? Are there still signs of worsening infection? Do not assume the fever is solved just because acetaminophen lowered the temperature. Acetaminophen treats the fever symptom. It does not treat the underlying infection. For example, if a patient with suspected sepsis has a fever and you give acetaminophen, the temperature may go down, but the patient still needs evaluation and treatment for the infection. Also monitor for side effects. Watch for nausea, vomiting, rash, itching, abdominal pain, jaundice, dark urine, unusual bleeding, or confusion. If the patient has an IV form of acetaminophen, monitor the IV site and follow facility policy for administration. Pop question. A patient's fever decreases after acetaminophen, but the patient is still hypotensive, confused, and tachycardic. What should the nurse do? A. Assume the patient is fine because the temperature improved. B. Continue to monitor and report concerning signs to the provider. C. Give extra acetaminophen without an order. D. Remove the patient's IV. The correct answer is B. A lower fever does not mean the underlying condition is resolved. Hypotension, confusion, and tachycardia are concerning and should be reported. Now let's focus on patient teaching. This is one of the most important parts of acetaminophen. Teach patients to read medication labels carefully. They should look for the words acetaminophen, APAP, or paracetamol. Paracetamol is another name for acetaminophen used in many countries. Teach patients not to take more than the recommended amount. They should not take extra doses because the pain or fever is not improving. They should contact a provider if pain or fever continues or worsens. Teach patients not to combine multiple products containing acetaminophen. For example, taking Tylenol, a cold and flu medication, and a prescription pain medication may accidentally lead to too much acetaminophen. Teach patients to avoid heavy alcohol use while taking acetaminophen. Patients with liver disease should talk to their provider before using acetaminophen. Teach patients to keep acetaminophen out of reach of children. Also teach caregivers to use the correct measuring device for liquid acetaminophen. A kitchen spoon is not accurate. For children, caregivers should dose by weight and follow the pediatric label or provider instructions. Teach patients to report signs of liver injury. These include nausea that does not go away, vomiting, loss of appetite, right upper abdominal pain, yellow skin or eyes, dark urine, unusual tiredness, or confusion. Teach patients to report rash, blistering, peeling skin, swelling, or trouble breathing. Now let's say this in patient-friendly language. You can take Tylenol for pain or fever, but make sure you do not take it with other medications that also contain acetaminophen. Check cold medicines and prescription pain pills carefully. Too much can hurt your liver. Call your provider if you have yellowing of your skin or eyes, dark urine, severe stomach pain, or a rash. That is simple, clear, and useful. Pop question. Which patient statement shows correct teaching? A. I can take Tylenol with any cold medicine because they are different. B. I should check labels so I do not take more than one medicine with acetaminophen. C. If my fever does not go down, I should double the dose. D. Tylenol is safe in unlimited amounts. The correct answer is B. The patient should check labels to avoid duplicate acetaminophen. Now let's discuss what findings should be reported to the provider. Report suspected overdose right away. This includes taking too much at one time or taking multiple products that contain acetaminophen. Report signs of liver injury. These include right upper quadrant pain, yellow skin or eyes, dark urine, pale stools, severe nausea or vomiting, loss of appetite, unusual fatigue, confusion, or bleeding. Report abnormal liver labs if you notice them, especially rising AST, ALT, bilirubin, or INR. Report signs of allergic reaction. These include hives, swelling of the face or throat, wheezing, difficulty breathing, or severe itching. Report serious skin reactions. These may include rash, blistering, peeling skin, or sores in the mouth. Report fever that continues or returns, especially if the patient has signs of infection. Report pain that is not controlled. For example, if the patient reports 9 out of 10 post-operative pain after acetaminophen, the provider may need to adjust the pain management plan. Also report if the patient has a history that makes acetaminophen risky, such as severe liver disease or heavy alcohol use, especially if the order does not reflect that risk. Pop question. Which finding is most concerning after acetaminophen administration? A. Pain improved from 6 out of 10 to 3 out of 10. B. Temperature decreased from 101.5 to 99.8. C. Patient develops yellowing of the eyes and right upper quadrant pain. D. Patient says the tablet tasted bitter. The correct answer is C. Yellowing of the eyes and right upper quadrant pain may suggest liver injury. Now let's compare acetaminophen with other common pain medications. Compared with NSAIDs, acetaminophen is less likely to cause stomach bleeding and kidney injury, but it does not treat inflammation well. Compared with opioids, acetaminophen does not cause respiratory depression, sedation, or dependence the way opioids can, but it may not be strong enough alone for severe pain. Compared with aspirin, acetaminophen does not have the same antiplatelet effect, so it is not used for heart attack prevention. This is a common nursing school trap. Acetaminophen is not aspirin. Acetaminophen is not ibuprofen. Acetaminophen is not an opioid. It is its own medication with its own benefits and risks. Here's a memory tip. Tylenol is for temperature and tenderness, but too much troubles the liver. Temperature means fever. Tenderness means pain. Too much troubles the liver. That gives you the main points quickly. Now let's walk through a clinical scenario. You are caring for Mr. Lopez, a 68-year-old patient admitted with pneumonia. He has a temperature of 102 degrees Fahrenheit and mild body aches. The provider orders acetaminophen 650 milligrams by mouth every 6 hours as needed for fever. Before giving the medication, you check his allergies. No known drug allergies. You check his medication list. He is not receiving any other acetaminophen-containing medications. You review his history. He has hypertension but no known liver disease. You check his most recent labs. His AST and ALT are within normal limits. You assess his temperature, pain level, mental status, blood pressure, heart rate, respiratory status, and oxygen saturation. You administer acetaminophen as ordered. About an hour later, you reassess him. His temperature is now 100.4 degrees, and he says his body aches improved. But you also notice his oxygen saturation is dropping, and his respiratory rate is increasing. What should you do? You should report the respiratory changes. The acetaminophen helped the fever, but the pneumonia may still be worsening. This is an important nursing lesson. Do not focus only on the medication response. Always reassess the whole patient. Let's do another clinical scenario. You are caring for Ms. Carter, who had abdominal surgery yesterday. She has scheduled acetaminophen 1,000 milligrams every 8 hours, and oxycodone acetaminophen as needed for breakthrough pain. Before giving the PRN medication, you notice she already received 3,000 milligrams of acetaminophen today. What should you do? You should pause and clarify the order or notify the provider. Why? Because the PRN combination medication also contains acetaminophen, and giving it may push the patient over the recommended daily limit, depending on the facility policy and provider instructions. This is exactly why nurses must add up acetaminophen from all sources. Never assume the prescriber or pharmacy already caught everything. Medication safety is a team responsibility, and nurses are the final safety checkpoint before administration. Now let's review the most testable nursing points. Acetaminophen is an analgesic and antipyretic. It treats mild to moderate pain and fever. It is not an NSAID. It is not an opioid. It does not have strong anti-inflammatory effects. The major safety concern is liver toxicity. The nurse should check the total daily dose from all sources. Watch for combination medications. APAP means acetaminophen. Avoid alcohol or use caution with alcohol because of increased liver risk. Use caution in liver disease. Monitor AST, ALT, bilirubin, and INR when liver injury is a concern. For suspected overdose, acetaminophen blood levels may be ordered. The antidote for acetaminophen toxicity is N-acetylcysteine, or NAC. Teach patients to read labels carefully. Report signs of liver injury, allergic reaction, severe rash, overdose, uncontrolled pain, or persistent fever. Now let's finish with 5 true or false review questions. Question 1. True or false? Acetaminophen is used to reduce pain and fever. The correct answer is true. Acetaminophen is an analgesic, meaning it helps with pain, and an antipyretic, meaning it helps reduce fever. Question 2. True or false? Acetaminophen is a strong anti-inflammatory medication like ibuprofen. The correct answer is false. Acetaminophen helps with pain and fever, but it does not have strong anti-inflammatory effects. NSAIDs like ibuprofen are used when inflammation is a major concern. Question 3. True or false? The nurse should check for other medications that contain acetaminophen before giving a dose. The correct answer is true. Rationale. Acetaminophen is found in many prescription and over-the-counter products. Patients can accidentally receive too much if the nurse does not check the total daily dose from all sources. Question 4. True or false? Yellowing of the skin or eyes, dark urine, and right upper quadrant pain may be signs of liver injury. The correct answer is true. These findings may indicate liver dysfunction and should be reported to the provider, especially in a patient taking acetaminophen. Question 5. True or false? Naloxone is the antidote for acetaminophen toxicity. The correct answer is false. Naloxone is used for opioid overdose. The antidote for acetaminophen toxicity is N-acetylcysteine, also called NAC. And that is your beginner-friendly nursing pharmacology review of acetaminophen, also known as Tylenol. Remember, Tylenol is common, but it is not harmless in unlimited amounts. Use it for pain and fever. Check the total daily dose. Watch the liver. Teach patients to read labels. And when in doubt, pause and clarify before giving the medication. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.